Good morning, Lisa.
Good morning, Heather.
Hey, Lisa, are you able to hear me?
I think you just talked, but it's really quiet.
1 second. Is that better?
Yeah, that's better.
Okay. I had my mic settings all down for some reason. I have no idea why I would have
Okay.
done that.
No worries. Can you hear me okay?
Yes, I can hear you just fine. I do want to mention that the screen that is being shared right now, m- has the notes um for the on the PowerPoint, but if you go to display settings, which is like at the top left-hand corner, I think it says display
Uh-huh.
settings. If you click
Uh-huh.
there, it should have a swap presentation presenter view. There you go.
Okay, so Heather, from in here, those screens are the exact opposite.
Oh, really?
Yeah, so the
I
screen now that is in front of me at the mic is the one that you should be seeing, and the one up there is the one that the presenter should be seeing.
okay.
So what could I have done?
I don't think it's you. If I had to guess, it's maybe how the screens are like set up as a whole. So I
Okay.
don't think it was
Are you
you.
IT?
Yeah,
No, I have an issue.
what's up?
Okay, so I have somebody on Zoom. They are seeing the correct screen that I'm seeing here. So what have I done?
So seeing the correct.
There, okay.
Seeing the correct.
Okay, so the screen that I can see, right here, the one that everyone should be viewing.
Yeah.
Zoom is seeing this one. And I
Not
need
set up like
yeah,
that.
yeah, so,
Oh boy. What is this, the video camera? Oh, I just click it, see what happens. Nothing. And so.
sorry, I thought I had it set up correctly, because they were switched. And they saw this.
And if I change this slide, so it's changing. And you want it to show both this current slide and the next slide?
No, I want everyone in here to see this
Oh, to see
screen, and everyone
this.
on Zoom to see this screen.
I see, okay, gotcha. You should be able to. I, it's interview, no, that doesn't help either.
Is the other monitor set up as like screen one?
Thanks. They start showing this like slideshow from the beginning, something like that, and then you got the other view.
Okay, so Heather, what do you see?
It's correct.
Okay, so it's correct. Okay, okay, all right, awesome, and you can see here, just a second.
Yeah.
You can see here everything okay, Heather?
Yes, ma'am.
Okay, great, thank you. Hey Heather, everything look okay?
Yes, it just looks like the screen is minimized, like you haven't you're not displaying the PowerPoint anymore. So it's just like the regular what you see when you have PowerPoint open.
So every time when you change the presentation, you've got to go to this share button. And then you got to click on this little icon where it says, I had it. There's a way to change what we're sharing right here. Yeah. Oh, it's because I'm being super right now. It's because we have a different presentation up and so we need to. Wait, no, that is the right one.
That's the correct one right now.
No, but for some reason it's showing this other. I wrote the computer and I haven't done it
No, actually, it took a little while because
Then if you switch shares, it'll ask you like. Yeah, yeah, so you might have to just end sharing and then you can pick the one you want, so we would be picking. Oh, yes, you're totally right, screen 2. Then you can hit slideshow from the beginning. Okay, are you seeing it now? You seeing the full screen? Yeah, she should be seeing the full screen. I see it right here on yours.
Yeah, I'm able to see it.
okay, so can you just show us real quick, working stocks, it starts exactly again how we need to make everything work.
Yeah, you just close out of everything. You just gotta close out of everything. And then, so say this one went first, now you're switching over to this one, so you want to open this one?
No, it's not even saying it there, that's.
Oh, okay, gotcha. Well, you open that one wherever it is, and then you would close it
Well,
out.
let's get it there first, because I'm not very good about waiting until the last minute. Okay, so I don't even think it's saved.
Presentation.
Yeah.
I used to do this a lot before the pandemic, but I haven't done it through the pandemic. Was it a PowerPoint?
Hey Heather, everything look okay?
Yes, ma'am, everything looks fine.
So then once you're done with this one, you would just end slideshow, close out of the PowerPoint, and then open up his PowerPoint, which I just dragged it from your flash drive to here because the. Oh, yeah,
We're out of USB slots, so you can't use the keyboard if I have it plugged in, so.
Yeah, and then where is Bruce's whenever you have to go back to?
Oh, so he has.
Yeah, was his the second application or the second save?
Correct.
Okay, gotcha, let me put that one in there too.
Dr. Booth, when we introduce our, this, circular resolution.
And then is this his that he's presenting?
Oh, no, it's the one that you just closed. You just.
Oh.
No.
Oh, I'm not sure where she.
That one, right.
Yeah.
And so, let's see, in here.
Oh, yeah, we have it right there.
Because you never know. what to-
Yeah, we still have it open right here. Well,
You say that.
You can't even go by the number.
yeah, I need her to go to her emails and do that. That's where she pulled it from.
And so then, we have.
You can look at PowerPoint again, the one that you're presenting, so we can put it on the desktop. That way it's easy.
Okay, so can you go back in there?
Yeah.
So I'm gonna
But
move.
you wanted the file, right? You don't have to- It's right here. So it's pulling up between both. of them. Not from the, so I can save the presentation.
And Will, this is,
This other guy did last.
Yeah. She's on my. Yeah, she's a great work. Yeah, she's really good.
Say that, you good. And then on the left side, you'll see desktop. And so now it'll be.
exactly, this is Phil Lane.
Yeah, Bill, hey, how are you? Yeah. I bet. I'll be introduced.
Good, he's good to hear you. Good. Yeah, sure, we have a job.
Thank you very much.
This was it, SDH presentation.
Are you on it? Are you on it?
There.
You're the audience.
This one and this one, I'm not sure what order you're doing them in, but they're both right there for you. Perfect, okay, and then I also have them open right here, and I have the second screen showing, so this one's first, you said? And then you can go up here, slideshow. Oh, slideshow from beginning. And then she'll see the full screen, because it's the second one, you guys should be all good. If you have any issues though, just give IT a call, and run down your number.
Yeah.
Is this not showing? Nature, yeah, nature. Thank you.
The only
We'll
thing,
go with that. We'll show our little.
The only thing you would-
Thanks for that.
is you have to see that.
Yeah.
They always- That would be during his business session.
It's like to the next slide, like.
It's not done.
Yeah.
You can say there's a code that could be used because otherwise. I'm gonna be able to get it back. The messages.
I would like to see that.
Yes, they would. Yes, they absolutely would. Hey, Molly, I just want to make sure that, I think we're all good. We're just going to.
There you go, that's the entire presentation, thank you very much for coming.
And both of their.
You're not gonna be surprised by anything.
Should be split. Okay. All right.
Famous last word, we're gonna totally mess this up.
All right, everybody. Welcome to this week's Grand Rounds. My name is Vin Vu. I'm one of the chief surgery residents and also chair of the chief council. Today I have the pleasure of introducing our two speakers. The first will be Mr. Phil Lakin Jr. Mr. Phil Lakin Jr. is a native Tulsan. After graduating from Jenks High School, he earned his BBA and MBA from Baylor University. In 1999, after working with both the Anderson Consulting and Baylor University, Tulsa Community Foundation's board selected Mr. Lakin to be TCF's first and only chief executive officer. Since then, due to the generosity of Tulsans, TCF's asset size increased from $117,000 to $6 billion. In its 25 years, TCF has grown to become the second largest community foundation in the US out of a total of 900. More importantly, TCF has granted more than $3.5 billion to charitable organizations and causes. Mr. Lakin has served the city of Tulsa as one of the 9 elected city councilors since 2011. Phil and his wife, Adrienne, have been married for 28 years and have 3 handsome and active sons. Phil is one of approximately 50 individuals who has climbed all 70 plus peaks in the continental US that exceed 14,000 feet. He has attended the last 42 Indy 500 races with his father. Please welcome Mr. Phil Lakin Jr.
All right, I've given a lot of speeches and I've never given a speech where the entire room sits on the other side of the podium. So this is great. Well, thank you guys for having me. It's really my pleasure to be here this morning to tell you a little bit more about Tulsa Community Foundation. So I'm gonna go quickly. I have about 15 minutes or so and I have 49 slides. So you've been there before. So we're gonna move very fast. I hope this is all new information for you. And I know you're just getting started, many of you in your professional careers. But as you go further in life and as you become more charitable, I hope you learn from this presentation so that you can give into our community and give to others through entities like Tulsa Community Foundation. So let me get this little chat thing off of here. Hopefully it worked this morning. All right, so we were organized in 1998. 19 people came together from the Tulsa community to create Tulsa Community Foundation. And as you heard, we're celebrating our 25th year. Most of this was given away in my bio. So we're at $6.4 billion, which is a whole lot of money that is sitting here in Tulsa for the forever benefit of Tulsans and Northeastern Oklahomans in the grand scheme of things. There are 900 community foundations across the country, and this just provides a little bit of relativity to where we as Tulsa Community Foundation stand across the country. You can also see Oklahoma City Community Foundation is number 17 on the list. So out of the top 20 community foundations, little old Oklahoma has 2 of the biggest community foundations in the nation. And some of these have been around for over 100 years. We were just created, as you heard, 25 years ago. Oklahoma City created back in the 60s. But I'm really proud of what we do in the state of Oklahoma in putting others first. And this just demonstrates kind of our commitment to putting others first. $3.5 billion out the door. So we're not just sitting on money. We're not just sitting on assets, making them big so that we can say, hey, we're the second largest community foundation in the country. That's not what we're about. We're about putting money back into the community as well. But we are like the savings account for the community, the savings account for charitable activities. The United Way, which some of you all know about, most people give into the United Way, and then the United Way spends all of that money that year. So 25 million bucks or so. A lot of people put money into the community foundation that goes out, but a lot of the money stays for the future benefit of multiple generations, not just this one. So we have 2,000 plus funds, about 2,200 funds at the Community Foundation, and they're really organized across these different fields. Donor advised funds are predominantly what we have. So a donor like me, I put money into the Community Foundation. It's called the Phil and Adrienne Lakin Charitable Fund. I get 1 tax receipt out, and then I tell the Community Foundation where I want to give. If I want to give to my alma mater, Baylor, great. If I want to give to Oklahoma State, where our second son went, great. If I want to give to Mayo because that's where a loved one received treatment, then that's fine as well. but we really direct Tulsa Community Foundation where to go. TCF just does all the back office work. So here's a list of some of our donor advised funds. Obviously, we have about 2,000 of these, and they go across the full gamut. From me on the very small side to George Kaiser on the very large side. And we do all the charitable giving for Quick Trip. So every dollar that Quick Trip gives, whether it be in Tulsa or in Wichita or in Atlanta or in Phoenix, comes through the Community Foundation. Same thing for a lot of those other corporations that are listed. Folds of Honor Foundation, many of you all know that one as well. And then we are endowment, we're the manager for endowment funds for a whole host of nonprofit agencies. So they put their money with us, we save it, we invest it, and then we distribute a portion of that back out to them so that they can use it for their charitable needs every single year. So about 300 of these. But it really is more efficient for them to do it than to sit around, read a paper, choose stocks, invest, maybe good or bad. They can just put it at TCF. We do all that for them and then take care of the back office work. So here's some of our growth over the last 7 years. The top line that goes to 1880 is the number of donor funds that we have through 2023. And then the number of funds we're closing about every single year. TCF on a consolidated basis, we're at $931 million, and you can just see the amount of money in red that comes in. So in 23, we had $288 million come into just the Community Foundation and $185 million going back out, which just goes back to what I was telling you. And then when you consolidate a whole bunch of other entities underneath us, that's where you get to the $6.4 billion. And last year we had about $1 billion come in, which is astonishing if you just try to wrap your head around how much $1 billion is. And then $300 million go out. And I'll provide a little bit of relativity here. So, you know, sometimes I just get to talking about these numbers that are even big in my mind. So $329 million is what TCF put out. That $379 million to the right in 2023 is the general operating fund for the city of Tulsa. So TCF put 329 out into the community, and the city of Tulsa spent 379 in just operations for police, fire, accounting, streets, everything that you see in the city of Tulsa. So that's how important the charitable sector really is in our community, and that's just Tulsa Community Foundation. That doesn't even include all the other foundations that are in town. So beyond just all of this work that we get to do for nonprofits, donors, corporations that want to be very generous to others, we also get to do these really incredible things. So we got to accept all the donations for Gathering Place and then build Gathering Place and then give it to River Parks to manage. All these other things as well, which I'll go through, but here's just a few stats on Gathering Place. And you're going to be really smart if you are out at Gathering Place and you go, you know what, there's 1.2 million shrubs out here at Gathering Place, or 16 acres of wildflowers, or 3.3 million visitors in the first year. We have about 2.5 million visitors now, but an astonishing amount of just good work that was put into that place to make it a place where we can all get together. And it's amazing how many people come to Tulsa just to see Gathering Place. I know you all have been there, so you know these pictures was just going to fly through. Greenwood Rising, if you haven't been there, it's just a memorial, if you will, and a historical center for the terrible acts that happened in late May and early June in 1921. But we raised all the money and built that facility in about 7 months so that it was ready for the centennial dedication ceremonies. We built the Dillon Center, the Woody Guthrie Center, Guthrie Green. We're helping with OK Pop. So we're involved in a lot of things. And then the Beautification Foundation. It's really kind of weird how we get involved in these things, but I-44 was just going to be a bland piece of concrete running right through the middle of our city. And we said, hey, we've got to add some aesthetic improvements to it. So we added those towers, which some people think are totem poles, but they're not totem poles. Turkey Mountain, hopefully many of you all have been up to Turkey Mountain, but most of the master plan up at Turkey Mountain came through the work of the Community Foundation and others working through the Community Foundation. So really taking what was and making it something that we're all very proud of, and then adding lots of points of access and new things. This used to be the River Parks Trails. Back 20 years ago or so, we had just a nice strip of asphalt over there that somebody probably put down overnight, and a chat trail that was probably some leftover stuff, probably cancer causing as well. So we took that trail and made it into this trail. We have bicyclists on one side and pedestrians on the other at a cost of about $1 million per mile back then. So let me show you this video. This goes over just about everything that I just went through, but I hope you get more pride out of what Tulsa Community Foundation does through this video. And remember this, if you're not from Tulsa, if you're from some other city or town, they probably have a community foundation too, doing just about everything that TCF is doing. Maybe not as well, but America's most generous. These 4 words intentionally define what Tulsa is and always has been. A community built upon charity and service to others. Generations of community leaders shape our collective responsibility as Tulsa begins. 25 years ago, in November 1990, every other major city has had a community level. These people live with a vision and expectation of giving that motivates us as ultimately to be at levels that are above and often unnecessary. In passing down this collective responsibility to care for our neighbors, they created a vehicle for the community to ensure that the needs of Oklahomans could be met. For Tulsans here today, and for those who come, they stood together to give Tulsa one of its greatest gifts, Tulsa Community Foundation. Yeah. Today, even the greatest of imaginations couldn't have predicted what donors would have contributed to and accomplished through TCF. In late 1998, TCF was America's smallest community foundation, with just over $100,000 in assets. Today, because of the deep generosity of so many Tulsans, America's most generous city is embodied in the fact that out of 900 community foundations nationwide, TCF is the second largest, with over $6 billion in assets. Over the last 25 years, approximately 2,200 donors have chosen to create charitable funds at TCF, which have provided more than $3.5 billion in philanthropic grants into charities across Tulsa, Oklahoma, the United States, and the world. Visionaries and leaders imagined all at Tulsa Community and collectively utilized TCF to make their plans come true. Gathering place, Guthrie Green, privatized Tulsa Zoo, Turkey Mountain, One Oak Field, and the expansion of the area in the Tulsa Arts District, Greenwood Rising, I-44 aesthetics, and so very much more. And then there are the opportunities for collective handouts, where individuals from all across Tulsa join together to give single dollars to thousands of dollars, meaningfully assisting the victims of national disasters, survivors of the St. Francis shooting, patients undergoing cancer treatment, and employees, local and national corporations who are experiencing a hardship. TCF is the common thread in these stories, creating a community bound by ideas, goodwill, and collective impact. For those of us, we honor and thank you for setting the standard by which we must give and give back. To the president, their duty and opportunity is ours. We must aim to make this great city even better. Teacher, this is our community foundation. It is Tulsa's community foundation. We help you share and make it grow. That Tulsa can always be the most generous city in America. So that's it. I hope you learned a lot about TCF this morning, and I hope you're proud of what our city is and always will be. We have this reputation of being a very, very generous city, America's most generous city, and something we have to hold dear so that we can not just have it today, but also have it in the future as well. Good luck, have fun, and Bruce Dart is next.
All right, before we begin with the next speaker, I just want to let everybody know that the activity code for this session is 3119. So if you guys want to go ahead and submit that, the activity code is 3119. I personally thought that was a great presentation. Being from out of town, I've had the opportunity to benefit from a lot of these places and activities. So I appreciate Mr. Lakin's work with all of that, and I think it's something that we can all be proud of, and I hope to contribute in the future as well, and I hope that you all do as well. I'd like to move forward with introducing our next speaker here, Dr. Bruce Dart. Our program is underwritten by an educational grant through OSU Medical Center, Graduate Medical Education. Disclosure statement has been signed and is on file in the GME office. Dr. Dart has served 5 local health departments in 3 states during his 44-year career path in public health. Currently, he is the executive director of the Tulsa Health Department, a local public agency, health agency of 340 team members, serving a county of over 670,000 residents. Dr. Dart serves in a leadership role as a member of several National Association of County and City Health Officials, work committees, and is also the past president and former board member. He is a member of the Public Health Accreditation Board and chairs their Accreditation Review and Idea Committee. He is a year 15 graduate of the National Public Health Leadership Institute. His team was co-winner of the Martha Katz Award for Best Project. He was honored to be named the 2022 winner of the Nacho Mo Mullet Lifetime of Service Award. He has received an appointment as a visiting associate professor of the Oklahoma University Hudson College of Public Health and serves on the board of directors at the Child Advocacy Network, Family and Children's Services, My Health Information Exchange, the More and Comprehensive Health Services, Family and Children's Services, and is also on the Blue Cross Blue Shield Caring Foundation Board of Advisors, the Impact Tulsa Leadership Council, the Tulsa Regional Chamber Board of Advisors, the Schweitzer Fellowship Advisory Board. He received his BS in biology from Drury University in Missouri in 1977, his master's in health services administration from Central Michigan in 89, and his PhD in health services, specializing in community health from Walden University in Minnesota in 2005. Please welcome Dr. Bruce Dart.
Okay, my presentation is all about why we have organizations like Phil Lincoln and why we need those in Tulsa. And mine's all about data. I know it's early, maybe it's late for some of you, so we'll try to keep you wait. Yeah, thank you. So good morning. So every presentation that we give out in the community, we want to make sure the community understands what the Tulsa Health Program is all about. We want people to know what our mission is, what our vision is, what our values are. And frankly, we're just getting ready to roll out a brand new strategic plan. So next week, this is all going to change. So we will move on. So what are social determinants of health? I'm sure everyone here is aware of what they are, but it's those conditions that affect where you live, work, and play. It encompasses all the broader factors beyond healthcare. And I know as physicians, you're used to seeing your patients. You deal with whatever health issue that they're doing on the spot. It's important to have an understanding of the factors that in their life that are impacting their ability to be healthy and impacting their health status. So the social determinants of health can be grouped in 5 domains: economic stability, health, education access and quality, neighborhood and built environment, healthcare access, and social and community context. These really impact these are the factors that really lead to most of the health disparities here in Tulsa County and in Oklahoma as well. So talk about some of them. Economic stability, crucial social determinant, encompasses income, employment, housing, food security. People living in poverty, as we know, face challenges in accessing all services. So if you've done any work, for example, in North Tulsa, when I first came to Tulsa, there were 35 food deserts in a 4 zip code in North Tulsa. We're starting to see more brick and mortar, starting to see more pop-up We're starting to see greater access to healthy food, but we still have food deserts all through Tulsa County where people have no access to healthy food. Education, access, and quality. You know, I used to say that education was a great equalizer, but not always. So as we know, it plays a vital role in health outcomes. Higher educational attainment is also associated with better health. Factors like literacy, early childhood education can significantly impact health education. Lower levels of education correlate with poor health literacy, affecting health decisions and access to resources. And lack of knowledge about preventive care and healthy lifestyles can, of course, perpetuate health issues. One of the things that we found out when we were signing people up for ACA through the marketplace when Obamacare first opened up was really the lack of health literacy. And then really the stigma around things like in Oklahoma, a red state, accessing healthcare. You know, we created a program where we had all the hospitals came together, nonprofits came together. We had 4 sites when Marketplace first opened up, and we were signing people up for health insurance with the ACA, and I was told that nobody would come and nobody would sign up. Well, that day we had 700 people show up at these 4 places, and we signed up people for the first time ever for health insurance. But the poignant thing is that at one of our sites, we had the media came and covered the event. A gentleman who never had health insurance his entire life, who cried when he signed up and got health insurance the first time in his life. When he walked out, he saw the TV cameras and he put his t-shirt over his face because he didn't want his neighbors to know that he was signing up for an ACA. So we have lots of stigma here in Tulsa County, lots of stigma in Oklahoma that contribute to a lot of our health disparities. Part of overcome health disparities, in addition to the social determinants, is a culture and a stigma that permeates that culture sometimes. So healthcare access, we know we need insurance coverage and quality of care. When we signed people up, no one had health insurance before. No one knew what a premium was. No one knew what a copay was. No one knew how to access their drugs at the pharmacy. So health literacy, we talk about access was other factors that impact access to healthcare. Even when people have it, they still don't in many cases. So our built environment, and you heard Phil talk about really our trail system. Tulsa and Tulsa County have an amazing built environment to stay healthy if you want to be healthy. Physical environment really where people can live and live, work, and play has a profound impact on people's health. Now, we know that we've got a great trail system, we've got sidewalks, but about half our community doesn't. We've got neighborhoods where there's no lighting, there's no trails, it's not safe to go walking at night, there's feral dogs running around. So built environment is extremely important. We talk about housing quality, neighborhood safety, access to our green spaces, pollution and transportation all contribute to built environment that allows people to be transient to get where they want, to have access to those places where they can be healthy. You know, we're in public health, we're a little arrogant. We say, go live an active lifestyle, go eat healthy, but kind of hard to do when you don't have access to a gym, you don't have access to outdoor green space, you don't have access to trails. We already talked about access to healthy food. So more than just telling people, is that we've got to walk that walk, and we have to make sure that those resources exist for everyone in our community, which is things that Phil and Community Health Foundation actually do. So social support, you know, social isolation is one of the biggest quantifiers of social determinants. So social support, we're talking about quality of relationships with family, friends, community members. Isolation is almost a killer in terms of health status and your desire and your mental health and your ability to be healthy. Social connections provide emotional support, it reduces stress, it improves overall well-being. As we know that when you're isolated, stress increases, your risk for adverse behavior also increases. So simple thing like having a social circle, being in a community that is open and available to you is extremely important. And for everybody that moves around, I'm a military brat. I'm used to being dumped in a new place every couple of years as I was growing up. A lot of people live in the isolated space and they're the same community every year. So eliminating that is one of the things that we at the health department are really looking at how we bring our community together. Especially in these crazy times that we live right now, keeping people connected is extremely important. So talking about health disparities and preventative differences has become a significant public health issue. Health disparities are preventable difference in burden of disease, injury, violence, or opportunity to achieve optimal health that are experienced by socially disadvantaged populations. I'm sure that you see a lot of the same clientele that we serve at the health department, people who live in situations where none of us want to live in. And we all have a responsibility not only deal with that health issue that they're presenting with today, but to talk about their overall health and overall health status and all these outside factors outside of healthcare and medicine that's impacting their ability to be healthy, those things that create health disparities in Tulsa County. So to give kind of overview, Dr. Alexopoulos asked if I talk a little bit about Oklahoma. So a statewide overview of social determinants. So Oklahoma, we have roughly 4 million people here. Our economic disparities, we rank in the lower half nationally in medium household income. While the state has significant urban centers like Oklahoma City and Tulsa, it's still a predominant rural agricultural state with small communities spread all over Oklahoma. State ranks really low as I said, in household income, but these rural communities experience higher levels of poverty than we see in the urban centers. Sadly, Oklahoma, I'm sure we hear all about the health rankings of Oklahoma. We rank amongst the worst states for key health metrics. We have high rates of obesity, smoking, and chronic diseases. Diabetes, heart disease are a consistent challenge. Many rural communities have no access to healthcare. There's not physicians in many of our rural communities. We have 13 rural hospitals, or 78 rural hospitals in Oklahoma. 13 of them are failing now as we speak. So the challenge is incredible. And getting providers in rural Oklahoma is extremely difficult. So our regions, we're going to break it down. So each region have a distinct social, economic, environmental challenge. We have Northeast, Southeast, so go down the list. So these regions are taken from the Oklahoma Department of Commerce. Each region has its own unique characteristics, and then these divisions help provide a clear understanding of regional differences. We're going to give you a little more detail about economic stability, education, social and community context, healthcare access, and neighborhood environment and health impact across different regions of Oklahoma. In Oklahoma, really, we're very much an individual rights state, and we're constantly being told to pull ourselves up by our bootstraps, which is kind of tough to do when you have no boots. And you will see some of that depending on where you're at in Oklahoma. So our central Oklahoma region, it's where it comes to Oklahoma City, which is our largest urban area. While Oklahoma City generally benefits from strong employment due to diverse industries, there are significant disparities. Some inner city neighborhoods experience unemployment rates as high as between 10 and 20%, compared to the city's overall unemployment rate of 2.7 in 2023. And this also, if unemployment is that high, disparities are as well. And then the healthcare access, Oklahoma City has several major facilities, including hospitals that serve large populations, but access to healthcare is uneven, with wealthier areas having more options and lower income neighborhoods having fewer. That notion that you hear if you're wealthy or healthy exists in Oklahoma no matter where you're at. Northeast Oklahoma. So they have an unemployment rate of about 4.4. Exceeds the state average, indicating that we have economic stability in several areas. And most of this data came from the U.S. Department of Labor. So access to healthcare is a pressing concern, particularly in rural areas where residents live over 30 miles from the nearest healthcare facility. Imagine giving birth and your facility is 30 miles away. There's no ambulances. If an emergency occurs, you're pretty much on your own to get to that facility. And of course, food insecurity continues to be a major issue in that Northeast region. We have high rates of food insecurity. The social context, we have high chronic disease in rural areas. So if you look at the difference in data between, in our urban areas, we think our health disparities are high enough. You compare that to rural Oklahoma, There's no comparison. It's much more difficult to be healthy when you live in rural Oklahoma than if you're living in one of our urban centers. Northwest Oklahoma. So once again, in Northwest, the economy heavily relies on agriculture and oil. Poverty rate's about 15.6%, which is higher than national average. Access to healthcare remains a critical issue with average of only about 2.5 primary care physicians per 1,000 residents in many counties. I think last poll I saw, Oklahoma was 49th in the country in a rate of primary care provider to patient. So, you know, we're always hearing about how bad we are and how on the bottom we are on all these health data and on these health metrics, that those things have to change. And you look at things like mental health services are particularly scarce. They're scarce in the rural area, in the urban areas. Can you imagine trying to access mental health services in rural Oklahoma? And that includes using telehealth. You know, during the pandemic, all the hospitals in Tulsa average about 800 telehealth calls a day. They don't have that capacity, that resource, although we're building that. But rural Oklahoma, telehealth right now, probably their greatest tool that they still don't have complete access to. Only about 20% of residents in rural Oklahoma are receiving any mental health care. Of course, that we talk about 20% receiving care. That's, I think, a large number who don't. And we're always focused on who's able to access, as opposed to how we can increase that access. My wife is actually a clinical psychologist. She came to Oklahoma, and I told her there's not much of a mental health system here. And there's a lot of attention to focus on mental health now. I think we're seeing some resources be important to that, but it's not, I think, a system we can build overnight. So it's starting to come together. We have a long way to go. Southeast Oklahoma, it's characterized by, of course, rural and tribal populations. We have significant economic challenges and, of course, health disparities. Area boasts the highest poverty rate in Oklahoma at 19.4%. Of course, high poverty, poor health outcomes. Education is a crucial factor. Only 77% of students graduate from high school in Southeast Oklahoma. And of course, limiting opportunities for upward mobility. Region also faces high rates of preventable health conditions such as diabetes, hypertension, which can be mitigated with better access to healthcare. So we have healthcare access, we have low education rates, economic stability is very poor. And then moving to Southwest Oklahoma, where economic conditions still significantly do, but they vary because we have Fort Sill in Southwest Oklahoma. Unemployment rate here is only about 3.9%. So you see how unemployment varies throughout the entire state. It's better than state average, but surrounding rural areas still experience economic challenges. So Lawton is home to 2 major hospitals. Rural areas, though, struggle with healthcare access, creating disparities in these health outcomes. And then additionally, environmental issues such as poor air quality and limited access to safe drinking water can significantly impact public health, which is an issue in Southwest Oklahoma. And then South Central region, that's a mix of urban and rural dynamics. The median household income is approximately $45,000, which is below the national average. Healthcare access is inconsistent with some areas, designated with healthcare provider shortage areas, which of course limits your access to care. Education and job training programs are vital in this region, as low adult economic attainment contributes to ongoing economic struggles. So apparently it's my job this morning to be the buzzkill in the room, so I keep giving you all this great news about how healthy and unhealthy Oklahoma is. But that's just, you know, that's the state we live in. That's the challenge that hopefully all of you who are our residents or med students will stay in Oklahoma and start to impact some of our provider numbers. You know, as Lisa said, I teach at OU. I teach both med students and MPH students, and I implore them all to stay in Oklahoma. So I hope that's a decision that everyone in this room will make as well. So health disparities by region, you know, as you saw, each region has a different set of health disparities. So we really want to tailor strategies to address issues within specific areas. So, and by just focusing on these specific needs, which means we need a state health improvement plan that's going to be different. There's no one size template fits all to apply to the different issues that we see from region regions. So you see the list where each region needs a different list of needs and services. So Tulsa County, where we are now. So let's get a little deeper into what we see here. So this slide demonstrates disparities in both access to healthcare measured by insurance coverage and socioeconomic status, which is measured by median household income. This is across different regions in Tulsa County. And these are regions that when we did our community health needs assessment, we broke the county up into 9 regions so we could ensure that we had broad representation in our study. So the left chart shows a percentage of people who are insured in different regions of Tulsa County. East Tulsa, almost 79%, but North Tulsa, 77% lag significantly in terms of the percentage of insured individuals. The right chart illustrates the median household income by region, revealing a clear gradient between North Tulsa and East Tulsa, which shows significant lower median incomes. Strong correlation between income and healthcare access in higher income regions like Jenks, Bixby, and South Tulsa, who have the highest insurance cover rates as well. So, and of course, conversely, North Tulsa, East Tulsa with the lowest rates. So even in our own communities, as some of you might have heard that back in 2007, there was a study done called the Loon Report that was released that measured the difference in life expectancy between North Tulsa and South Tulsa. In 2007, that difference was 14 years. So that, of course, garnered a lot of attention, created kind of a stir of activity, and suddenly there was a lot of investment in this zip code in North Tulsa that had the 14-year gap. Well, we poured as a community about $40 million in that zip code. And so we started to see improvement. We got down to about 10 before the pandemic hit. And of course, it went up, and now we've measured. So we're down to about between 8.8 and 9.2 years, that gap. But what we don't tell people, don't tell you guys, is that life expectancy in Oklahoma dropped through the pandemic. So that's why the life expectancy gap in Tulsa County also dropped. So we have a lot of work that we actually need to do across the board. So these life expectancy gaps. So we talked about it. Now, data shows that 3-year rolling average in 2020, 2022, South Tulsa average life expectancy 7.1, North Tulsa 7.9. And of course, combination of factors impact these from the socioeconomic, environmental conditions, system inequalities. And that's why if we're going to address these health disparities, we need a comprehensive program. That's why we just tailored our new strategic plan at Tulsa Health Department that's equity focused for the first time. Because if we don't impact these health disparities and the inequality that we see in our community, these metrics aren't going to change. So we need a different perspective between public health and healthcare. We're talking about not just serving their healthcare needs, but serving their social needs as well. So heart disease remains the #1 cause of death in Tulsa County. These are disparities by race, Black, American Indian, and Alaska Native. Population experience the highest rates. North Tulsa also bears a disproportionate burden of disease deaths. So you can see that pattern. BIPOC populations, North Tulsa, East Tulsa, our communities that are really dominated by people of color always have the lowest rates. Cancer is the second leading cause of death in Tulsa County, with disparities mirror those that we see in heart disease. North Tulsa, along with Black, American Indian, and Alaska Native populations face high cancer mortality rates due to factors like reduced access to early detention and treatment. Screening is so important that they don't have access to. And then unintentional injury mortality disparities. Unintentional injuries include car accidents and poisonings are the third leading cause of death in our county. Downtown and North Tulsa are American Indian, African American residents, and Alaska Native are particularly vulnerable, facing significant higher mortality rates for these types of injuries. And we're still trying to really do the research to figure out why. Chronic lung disease includes COPD, or another major cause of death in Tulsa County. Highest rates are seen in West Tulsa and North Tulsa, and of course amongst American Indian, Alaska Native. Smoking prevalence and poor air quality, we think, contributes to that disparity there. We know that the tobacco companies really target right now our BIPOC communities. Our BIPOC communities are suffering more from tobacco use than our white communities in Tulsa County. Strokes, the fifth leading cause of death, with the greatest impact in Black and American Indian, Alaska Native communities in North Tulsa. These disparities are driven by higher rates of hypertension and diabetes, combined with barriers to accessing timely and effective health care. And you see that's the pattern. We're constantly talking about North Tulsa, East Tulsa, and West Tulsa. We always see the same pattern where those parts of our community always have the worst health numbers and health outcomes. Infant mortality rate in Tulsa County is higher than the national average. African American infants experience a mortality rate of more than double that of white and American Indian and Alaska Native. The chart to the lower right shows data for 2020, 2022, that 3-year rolling average of infant mortality rate by race and ethnicity in Tulsa County. Infant mortality rate for African Americans is 13.4 infant deaths per 1,000 live births, which is just not acceptable, compared to 5.5 for whites and 4.8 for American Indian, Alaska Native. Contributing factors include maternal education, births to unmarried mothers, and access to prenatal care. So, like the contributing factors for mortality, lower maternal education levels and higher rates of birth to unmarried mothers are prevalent in regions with higher infant mortality rates. Educational attainment is correlated with health literacy, which impacts an individual's ability to communicate with healthcare providers, understand and follow instructions, navigate the healthcare system. Women with less than a high school education also have poor health outcomes, including higher rates of infant mortality, smoking, diabetes, than women with high school diplomas. Children born to unmarried mothers have higher rates of infant mortality and increased likelihood of adverse birth health outcomes, such as low birth weight. And they're also more likely to live in poverty than children of married moms. And these children, as they reach adolescence, children of unmarried mothers are more likely to have low educational attainment, engage in sex at a younger age, and have a birth outside of marriage. One of the things we see, for example, we have a program, a health program called WIC program. It's with and infant children. We provide health and food education to pregnant moms and their infants, their toddlers up to 5. You know, we see in our WIC program, that program started in 72, we have like 3 or 4 generations on WIC. And that poverty cycle hasn't been broken. So responding to the cause without responding to the root cause is keeping us where we're at. So high teen birth rates and birth to unmarried women contribute to higher infant mortality rates due to several factors. Teen and unmarried mothers often face limited access to prenatal care, economic instability, higher rates of preterm birth and low birth weight, all of which increase the risk of infant mortality. Stress and educational barriers associated with teenage and unmarried pregnancies further exacerbate these risks, highlighting the need to provide target support and resources to improve health outcomes for infants. These 2 graphs, we see that African American and Hispanic moms contribute to a higher percentage of teen births and births to unmarried women in Tulsa County. This is actually a metric that I'm really proud of. When I first came here in 2010, we had the 2nd highest teen birth rate in the country. We've done tremendous work. We've cut that rate in half. We're now about 4th or 5th, but we're so much lower than we were, and that's because our community came together. You know, it's not popular to talk about sex in schools now. It's not not popular to talk about preventing pregnancy in schools now. We do more than talk about abstinence, but these things have to take place. Otherwise, the greatest poverty reducer and the greatest indicator of poverty in this country is teen pregnancy and teen births. If we don't break that cycle, we won't break that health disparity cycle either. So teen birth rates are significantly higher amongst Black and Hispanic populations in Tulsa County, particularly in North Tulsa, which is becoming much more diverse now. North Tulsa used to be our African American hub for our community, much more diverse, Hispanic, Hmong, Burmese, white population are moving North Tulsa, so it's not just a Black community anymore. Teen pregnancy associated, of course, with poor health outcomes, higher mortality rates, so we've already talked about. So providing education to these teens is extremely important now. There's, you know, our curriculum, we're in middle schools or in 7th grade and 9th grade in vast majority of schools in Tulsa County doing teenage pregnancy prevention programs. And we talk about all ways to not get pregnant. So I actually had a city councilor one time, and we make sure that our curriculum is available to all parents who can opt out their children if they want to. And we actually had meetings with parents before we started the program to go over the curriculum with them. But communication is really important. So we do that. I had a city council call me whose child went through the curriculum when their child was in middle school and wanted to know why we're telling kids that you won't get pregnant if you just have anal sex. So how we communicate is really important because that's not in the curriculum. So, but that's what the takeaway was. So how we communicate this information is really critical. So parents get the right information and hopefully can make the right decision for their kids. And if we're doing a poor job communicating, I really want to know that. So I appreciate that council member calling me. We took care of that issue, but it made sure that we don't get too complacent, that we're constantly rechecking what we do. Because the last thing we want to do is provide barriers for people to have access to this kind of information. So chronic disease are a leading cause of death in Tulsa County. Health behaviors such as poor diet, physical inactivity, tobacco use, alcohol consumption, of course, contribute to all these disparities. And they're greatly influenced by social determinants of health, such as income, education, and environment. Nobody wants to live unhealthy life. It's amazing what they don't know what unhealthy is. And part of all of our jobs is to be part of that mechanism that educates all of our patients. Physical activity can improve. Of course, we all know what physical activity can do. When we're concerned about lack of physical activity, which is more prevalent, of course, in lower income and less educated populations. If you look to our community, we did a sidewalk assessment when I first came here. We're doing another one now with INCOG. When I first came here, only 50% of our neighborhoods actually had sidewalks. We're starting to see that change. We're now around our community development table, where every new development that comes in, we have a conversation about health and all policies, and do we need sidewalks, do we need fences, do we need barriers? We'll make sure that whatever development is, it gives people the ability to also be healthy, regardless of what that is. I'm a biker. I'll bike through, take the trail from OSU up to Skytook, and the feral dogs in North Tulsa are amazing. There's so many of them. We have great trail systems going through there. People are afraid to get on because of these dogs. So we have to look at all the factors that impact people's decisions to be healthy, to exercise, to be active. And it's not just because they do or don't want to. So tobacco use, of course, remains a critical public health challenge in Tulsa County. I think I got my first death threats in public health over tobacco use. Smoking is more prevalent in lower income and less educated populations. Of course, that contributes to higher incidence of lung disease, heart disease, and cancer in these groups. And these charts show the smoking rates in Tulsa County are, of course, higher amongst individuals with lower income and education levels. The single most preventable cause of death and disease is tobacco. Tobacco is the only product I know that when used as directed kills people. And so, of course, our goal is to not use as directed. As you all know, you guys study this, it causes cancer, heart disease, lung disease, emphysema, bronchitis, chronic airway obstruction, premature death, premature birth. So constantly working on lowering tobacco use and getting tobacco out of our community. Education and healthy behavior. So individuals with higher educational attainment are more likely to have regular doctor visits. This graph shows that those with some college education have the highest percentage of regular doctor visits, followed by high school graduates, and lastly, those with less than high school education. I try to observe, and same thing with dental visits, where individuals have some college education really will go to the dentist. So once again, education really is important, and educational attainment. And that old adage about men don't go to the doctor, men don't go to the dentist. Well, no one goes if they're not educated. It doesn't matter. So you can kick stereotypes in, but educational attainment really matters, and not only in your ability to access healthcare, but your desire to access healthcare. So chronic disease in our older population in Tulsa County, so older adults experience higher rates of chronic disease, diabetes, high blood pressure, heart disease. These charts show rates of heart attack, diabetes, and high blood pressure increasing significantly with age. Age-related disparities exist, and our older age groups are more likely to be diagnosed with these conditions, highlighting the importance of screening and early detection. So, and of course, the presence of chronic disease in these older adults can be influenced by various social determinants, including economic stability, healthcare access, social support, which is one of the biggest issues with our older populations, and living conditions. So, and of course, economic instability in our older populations is always an issue. The more unstable you are economically, the less you are to access healthcare, even if you're on Medicare. So, addressing health disparities and key strategies and future directions. So, if we're going to address these things, we really need to take a multifaceted approach, expanding access to care, promoting education, driving cross-sector collaboration are essential, working closely with public health and healthcare. By engaging local communities and advocating for equitable policies, we can create long-term sustainable change. And bottom line is that we all got to come together if we're going to build a healthier, more equitable Tulsa. We need to expand access to healthcare. We do ensure that we have community-based interventions that tailor specifically to our underserved communities. Ensure that we have health literacy and education programs, really promote health literacy. It's important to have cross-sector collaborations, healthcare, schools, housing, businesses, must all collaborate to address root causes of social determinants. And then community engagement, empowering local communities through partnering through these grassroots relationships. It starts at the neighborhood level. We just recently acquired a mobile van so we can bring our services to the neighborhood, to the streets where people actually need it. During the pandemic, for example, we were at one of our Hispanic churches. We've been working very closely with the Hispanic community throughout my tenure here, at least I thought we were. And we're giving shots, giving COVID vaccinations, and priest walked up to me and was just chatting. And of course, our conversation, somehow we're really glad we're there. We're glad we're serving the residents of his community. He said, we're really glad you're here too, but what took you? Which is a knock upside of the head because, we always thought we were engaged. So engagement is a two-way street. And it's ensuring that you're connecting with who you think you're connecting with and they're connecting back. So, and you're not truly engaged unless you have that and you understand that so that you're all on the same page, which is my biggest challenge is getting people on the same page and moving in the same direction. So if you want, I know data is really, really exciting to watch and really, really exciting to see. If you want to see health disparity data, that's on Tulsa Health Department's health status report. We update it every 2 years. You can go to our homepage, scroll to the bottom for data and stats, and then just click on health status report. We've got, it's an 80-page document. There's so much data in there, it'll make you blind, but it's great information and we update it regularly. And the community accesses quite a bit as well. So I know I went through that kind of quickly, but I knew we had short period of time. So I talk fast as a rule because I've learned in public health, moving targets are the best one. So any questions for anybody today? Hearing none. I know you
Are
guys
there any ongoing conversations? Sorry.
Pardon me?
Are there any ongoing conversations about cannabis use? You mentioned wanting to limit tobacco use in the community. Are there any conversations at play about cannabis use?
About what? I'm sorry, about what use? Cannabis? We have lots of
Cannabis,
conversations
marijuana.
about cannabis use, and I've got a lot of colleagues in states that pass medical marijuana or just general recreational marijuana a long time ago, and we've actually gathered quite a bit of data about how it's impacted those states in Washington and Oregon, and we're starting to see the impact on families. And so that's part, I said earlier, we're getting ready to release our newest strategic plan. And part of that is to hopefully impact not only cannabis use, but opioid use as well. We do wastewater surveillance here in Tulsa County. We started that during COVID. We've expanded it to pathogens as well. And we're actually looking at expanding it to opioid and substances as well. So we can pinpoint how much that's actually going on in this community. So, yeah, quite a bit of conversation knowing that so far the data we've seen with cannabis use in states that's both medical and recreational isn't altogether positive.
Thank you.
You bet. Hearing nothing else, thank you all for your time and attendance this morning. Y'all have a great day.